Today I'm joined by Dr. Peter Purcell, Medical Director over at Horizon Surgical Specialists. Dr. Purcell, welcome to QC Morning.
Thank you, Cheryl.
So today we are talking about PAD. It's an acronym. What does it stand for?
So PAD stands for peripheral arterial disease, which is kind of a long way of saying a blockage in a blood vessel in your body.
Is this a pretty common disease?
It is. It's common and it's underdiagnosed. Between 8 and 12 million Americans actually suffer from it, and over half of those don't know that they have it.
What are some of the symptoms? Because, I mean, I've heard of it before, but I don't really know exactly what it is, how it affects the body.
Well, you can have it without symptoms early on, and it can be picked up by various tests. But if you get symptoms from PAD, they're generally going to start as pain, cramping, aching in the legs.
So if someone experiences those things, how would they know it's PAD and not something else?
Yeah, that's a good question. It could be a variety of things, as you'd think. One of the things is if you have some risk factors like cigarette smoking, obesity, family history, age greater than 60, you should get your primary care provider to do some simple physical exams and maybe an ultrasound test to determine if you do have it.
Okay. So, you know, you hear about certain diseases like heart disease affecting men more than women or women more than men. What is the case here? Does it affect a gender, an ethnicity more than another?
Yeah, good question. It does. It affects men more than women, although women still suffer from it often. There probably is some genetic predispositions. Family history has a lot to do with it. And then age. If you're older than 60, you're much more likely to get it.
Why age?
Because like everything else in our body, it doesn't quite work as well as we get older. The other thing about PAD is the result of cumulative effects of things like cigarette smoking, cholesterol in the body, and all those things just take years to cause damage.
So all those things doctors tell us not to do, it's going to catch up with us eventually.
Eventually it will.
I'm hoping there's a treatment for this.
Yeah, there's good treatment. That's the good news. If it's picked up early, the treatments are much less invasive. Medications, lifestyle management, exercise, and things like that. If it becomes a disease that's threatening to your life or limb, then we're going to be more aggressive about recommendations like angioplasties, catheterizations, or maybe even open surgery in cases.
And so all folks need to do is contact you over at Horizon Surgical Specialists, and you guys will give them a diagnostic?
We do. We start with physical exam, checking for risk factors, and then most of the time the good news is this disease can be diagnosed very well with non-invasive painless ultrasound tests. We do those too. Okay,
great information, Dr. Purcell. I feel completely enlightened. Thank you so much for joining us on QC Morning. For more information, just call the number on your screen.
This segment of QC Morning was sponsored by Horizon Surgical Specialists.